And should I go live also, please?
Yes, please.
Okay.
Aparna?
Should I start?
Yes, please.
Sorry, just a sec. Okay. Good evening, everyone, and a warm welcome to our esteemed guests for the first event of the year by the Health and Wellness vertical of CII IWN. Firstly, I would like to introduce Dr. Meenakshi Ahuja, Senior Director, Obstetrician and Gynecologist at Fortis Lafayette Hospital. She is also the President of the Indian Menopause Society in Delhi and has always been passionate about women's health and disease prevention. Our next guest is Dr. Glossy Sabharwal. She heads and serves as the Director of Radiology at Apollo Spectra Hospital, Jeevan Mala Hospital, and the Wish Diagnostics. A passionate doctor who has a strong conviction in the concept of proactive health with a focus on prevention and awareness. We are honored that Dr. Meenakshi and Dr. Glossy are taking out the time to be with us and will be glad to answer all your questions real time. Our moderator for this session is Mrs. Nandini Chaudhary, Chairperson CII IWN Delhi Chapter. The theme for this year is Women Rising, Breaking Barriers, Breaking Bias. Keeping this in mind, Nandini has curated this weekly series and started her tenure this year with the love and hate relationship with menopause. Today's session will focus on the myths and facts of menopause, which truly needs to be addressed, as we must realize as this is one of the biggest biological change in a woman's life. I request you all to please keep your cameras off and please be on mute. To start the session, I'd like to invite Nandini to take over. Over to you, Nandini.
Thank you, Aparna. Good evening, everyone, and a very warm welcome. Let's kickstart our year with our very first series on menopause, like she said, myths and facts. And we have Dr. Meenakshi and Dr. Glossy to take us through this journey of ours. They're both IWN members as well, so that's something we are very proud of. Dr. Meenakshi Ahuja is a senior director at the La Femme Hospital and also the president of the Indian Menopause Society. And of course, Dr. Glossy Sabharwal, director of radiology at the Apollo Spectra and Jeevan Mala Hospital, and also Wish Diagnostics. Welcome, ladies, and thank you for giving us your time to take us through this journey of menopause. Dr. Meenakshi, can I please start with you and ask you a few questions which can make us understand what menopause is and probably not make us so scared of that word. What is menopause? And is it just a cessation of periods or more than that?
So menopause is a very physiological or normal phase in a woman's life. And probably if you see more than one third of a woman's life or more than half of your adulthood is spent in menopause. I guess when you say cessation of periods, that's the easiest way of a woman to understand that she's hit menopause. But always remember that it has not to do with the uterus, but with the ovaries. A very basic thing that I would like to tell you here is that, our eggs are formed in the ovaries. We have two ovaries and the eggs are formed there. They are predetermined the day we are born. And they start maturing, which is when we start getting our periods. When the good eggs sort of start finishing off, that means the ovarian function starts receding. That is actually menopause, since those hormones which are released from the ovary act on the bone, brain, skin, the rest of your body, and on your uterus. So actually, that's the way you would see it, because the ovarian hormones acting on the uterus will cause the periods. And when the hormones finish off, the periods get over. But if a woman gets her uterus removed and still her ovaries are functioning, she may not get periods, but she will still not be menopausal either. So menopause is actually cessation of the hormones from your ovaries in a technical manner.
And what are the stages of menopause? How do we
menopause is that your periods stop. So suddenly one fine day, you may be getting your periods absolutely regularly, and one fine day they don't turn up and don't turn up ever again. That's normal. Otherwise, the periods may slowly sort of the gap starts increasing and the duration may start decreasing. And this may last even for up to 5 years, and this is called the menopause transition. We call it menopause when you have not had periods for a year.
Okay. Dr. Glossy, this is for you because this is the diagnostics which we need to know. What is the best way to diagnose menopause, and do we need to confirm menopause by ultrasound or blood test? Glossy, what would you say?
Thank you so much, Nandini, and it's a pleasure to be here. I've been associated with CII IWN for more than 3 years now and heading the vertical of health and wellness. It's amazing to see how important topics like menopause have been taken. It's when we come to the diagnosis of menopause, we have to understand, or diagnosis of any disease for that matter, that what are the biochemical changes that is happening. As Dr. Meenakshi rightly said, that the hormones, we have follicle stimulating hormone that drops. And because that drops, the ovarian function goes down. The ovaries tend to atrophy, become smaller in size. And that is when the one of the changes of menopause happens. The second change is that the vaginal pH also changes, which results in certain symptoms. So when we say diagnosis, it's actually a diagnosis of retrospect. You do not get your periods for 12 months and then you are labeled as having menopause. So that perimenopausal period, a woman comes up with this question that, am I having these things because of menopause? How do I diagnose? There are 3 ways to diagnose it. Number 1 are the vasomotor symptoms that you have. Your symptoms of hot flushes, irritability, mood swings, all that happens. And you do notice the change. Your friends, your family, they do notice the change. The second most important feature, which is often confused, and patients come with having this question that, is it UTI? Are the urogenital symptoms? There is irritability, there is itching down there, there is dryness. And because of this, it feels that, okay, maybe I'm having repeated UTI. So it is important to understand that these urogenital symptoms could be perimenopausal. You would be hitting menopause. So you have to consult with your doctor regarding that as well. So one of the diagnostic features are your clinical symptoms and your assessment. The second way is that we do an ultrasound transvaginal to look at the ovarian volume. And we see that if the ovaries are smaller in size, they have shrunken, that means we are hitting menopause. And third thing is that there is a blood test, follicle stimulating hormone, which we do not routinely recommend, but it is there when it comes to the diagnosis if we want to complete the list.
Glossy, there is also a lot of kits and things available online. There is, how accurate is a menopause kit that one gets off Amazon?
Yeah, recently, a lot of patients have started coming up with this, that, we have this kit that says I menopause, I sure menopause. So these kits basically test the hormone, which is the follicle stimulating hormone. But one has to understand that this is not a foolproof method. Secondly, that these kits do not serve the purpose of diagnosing you as having menopause. Because what the World Health experts have suggested is that these kits do measure your follicle stimulating hormone, they do measure your hormones in the body imbalance, and they can tell, but are they specific? There are patients who do not have symptoms of menopause. There is nothing at all, but their FSH would be, the kit would show that, oh, there's menopause. And then there are patients, and this has practically happened. So these kits are not something that the doctors, the World Health experts suggest to use. The best way is a clinical examination, your hormones, your clinical assessment by the doctor, and an ultrasound to look at the ovarian volume directly.
Nandini, if I may add here, I just want to add
please.
something. That menopause is, like I said, a very normal and natural thing. You don't need to actually have a diagnosis. It's just that when your periods
Absolutely.
don't come for a year, it's menopause. And normally the age of menopause would be 40 to 55. The average Indian menopause being about 46.1. So if your periods are getting delayed or, and they're becoming less heavy, you don't need to get worried. You need to just go for your regular blood work and your regular ultrasounds. When maybe Glossy will point out, yeah, your ovaries are getting smaller, your eggs are getting fewer. So you are kind of going on in that direction. It is only if your periods stop before 40 years of age that you must get a diagnosis made, be it the blood test and the ultrasound. Because if the periods stop after 40, it's a very important thing that we should not miss, that there's a premature ovarian sufficiency. So actually the diagnosis is pertinent with blood tests and ultrasound only if you're less than 40. After 40, irrespective, even if you're getting regular periods or you're getting irregular periods or you're not getting your periods, if there are no symptoms, you have to go for your annual, the blood test, the annual ultrasound, and the annual checkup with your gynecologist.
Great. Thank you, Dr. Meenakshi. That brings me to you, actually. Things to avoid for smooth transition to menopause.
Okay, so menopause, like I said, is something very natural and you can't help it. You can't decide whether, one day your periods stop, they're not going to come again or not. Or, you can't say that if they come back 2 months later, that's also normal. If they don't come back at all, it's normal. Now, the point is how to avoid the menopausal symptoms which may occur, which actually don't occur in every woman. So every woman who's 35 plus is actually very worried that when menopause comes, there's something she's going to become abnormal and like a tigress and probably get angry at everyone or lose her confidence. Sex may not be the same. Life may not be the same. It's actually not true. Menopause is normal. Menopause symptoms may not be normal. So how to avoid those symptoms is actually that once you're 40, you start working towards it, that doesn't hit you when the symptoms occur. If they do occur, it's not necessary that they will occur. So if you have a busy lifestyle, you're involved in some hobbies or normal activity, if you get into that depression, that emptiness syndrome, children have left the house, husband is busy with work, now I have nothing to do, it's going to hit you harder. But if you have an active, busy lifestyle, you have your own hobbies, and I personally feel that, you learn that you're living for yourself and not depend on others. So mentally, there's a lot of things happening, which you must keep yourself mentally strong, have a good bunch of friends, a lot of activities to do, try to be financially independent. Of course, that always helps a woman at any time. That becomes important. More importantly also is your lifestyle. So regular exercise will definitely help you with because some people are very worried about their weight gain and all happening at this time. So regular exercise will definitely cut your symptoms of menopause. If you have habits like smoking, you must cut down smoking completely. Hot flashes is a very common symptom of the onset of menopause. That definitely is related to smoking as well as to alcohol intake. So a lot of people have their hot flashes with wine, red wine also. So probably you should cut down your alcohol intake. It's going to be better. So probably that basics about keeping yourself busy, eating healthy, and probably your calorie requirements decrease after 40 because your BMR goes down, and getting your regular blood work done, your ultrasound done, you will definitely be able to have a smoother menopause than most women. And if there are any symptoms, see your doctor at the outset because there is remedy available for all of them.
Thank you, Dr. Meenakshi. So like Dr. Meenakshi spoke about ultrasound, Dr. Glossy, what would you say? How often should the basic scans be done, like ultrasound or MRI or I don't know, whatever else that is needed in a routine perimenopausal state or a menopausal state?
So Nandini, this is a very pertinent question, and many times girls come that, I'm hitting 40, what are the checklist of tests to be done? This is not that one size fits all. The most important thing is that what is your family history? What is your risk factor? So you should not say okay, this is a package that is available in the lab, and the lab says that this is young women, this is menopausal women, this is 40 plus, this is this. Do not go by that, because that, I feel, in India is not regularized at all. This needs to be checked and assessed by the doctor. Like we have, like if a patient walks in the clinic, I have a whole checklist right from head to toe, that what are your symptoms, including your personal history, your history of any surgery, whether you had cesarean or not, whether your periods were regular or not, what about your family history of breast cancer, cervical cancer, uterine cancer, obesity, your family history, all of that. And then comes a checklist that, okay, this needs to be done. And the checklist goes every year, this needs to be done. So your annual checkup should be done with your doctor once a year. And of course, ultrasound, we suggest, because it has no radiation, that should happen once a year. Mammogram, we prefer 1 to 1.5 years gap, depending again on your history and whether we do a 2D or a 3D. So all this, and pap smear once in 3 years. So this depends that what is your history and what kind of pap smear is done, and whether the previous pap smear was normal or not. So this is a very customized check that we do. We doctors like to do.
So again, to Dr. Meenakshi, once we've done our scans and things, are the menopausal symptoms same for everybody, or or are they different symptoms? How does one know? Because you know how it is, we women share everything and we try to find out. One would say I'm gaining weight, one would say something else. Is it same for all, or is it different? What would you say, Dr. Meenakshi?
Yeah. So I think symptoms not necessarily are going to be there the same for all. Some people may have something, some women may have no symptoms at all. But yes, you must realize that even if you don't have any symptoms, your estrogen is going down. So your health, cardiac health is now more vulnerable. Your bones are going to become weaker. So even without symptoms, these things are bound to happen. Your estrogen is going to go down. So then your vaginal atrophy is going to occur. The urogenital area is going to get affected. Maybe in 5 years, maybe in 10 years, maybe in 20 years. Your muscles are going to get lax in the pelvis. The hair thinning is bound to happen. The skin is bound to have changes. So there are certain signs. I mean, one has to be very, pragmatic about this. You are going to have signs of aging. And the lack of estrogen is also going to have some effects. You are going to be more prone to diabetes. So these are things which are bound to happen. And that's why you need to be more particular about your health and seeing a doctor. Comparatively, compared to, less than 40, you can actually tend to be very casual about everything. Now, coming to the symptoms that women may have, the commonest symptom that we see when women are going to hit menopause, that's when they're starting or in their menopause transition, is bound to be things like hot flashes. Now, hot flashes are actually very transient. They are not going to stay for your life. They may happen for 2 months, 3 months, 6 months, maybe a year, although there are some patients who have them for more than 5 years also. One tends to have depression, or low feeling can happen. Loss of self-esteem may happen. It may take a hit on your sex life because of mental issues at this time more than anything else. As time advances and as menopause progresses, like I said, the urogenital area is bound to get affected. And that's when, the vaginal dryness is going to happen. Because of the urethral dryness, you're bound to be more prone to UTIs. So that usually may not happen as soon as you hit menopause, but maybe say 5 or 10 years later. Bone health is going to suffer, and that's why osteoporosis is a big reality, which we need to see, because we want women to be fit at 40, but we want them to be, really healthy and independent even at 80. So basically, I say that at 40, it's not about symptoms. It's because it's an investment into your future so that you're independent at 80. And that's why regular check needs to be done. The symptoms that women get distressed about are either depression, hot flashes, mood swings, hair fall. Some may have weight gain. Then later, like I said, the urogenital symptoms, or being more prone to fractures. Women are not Maruti cars. Everyone's not going to have the same symptoms. Every woman is different, and thank God for that. Otherwise, my work would be so boring. I deal only with women. I think that's the, the beauty. Every woman is an independent individual woman. And that's why, please don't think that because your friend had that, you're going to have that problem too.
Thank you, Dr. Meenakshi. Dr. Glossy, if somebody gets regular periods even after 55 plus, is it a red flag sign there?
See, this is a condition which is known as late menopause. The usual age, as Dr. Meenakshi said, is about 46 years in India. So the range is 41 to 51 years. So if you are having your periods when you are 55, that means that your body is producing extra estrogen. For everyone to understand that that hormone is not good when it's produced for a longer period of time. So that condition is known as late menopause. Now, what are the repercussions that it has? And as far as your tests are concerned, what needs to be another red flag to be added to it is that you need to get yourself checked for certain things like, number one, your BMI. Your BMI must be kept below 30 because obese women have more estrogen. Because they have more estrogen, their periods could be longer. Thyroid is another thing. So one is your BMI, second is thyroid. Thyroid can result in early or late menopause. So that is another thing which you need to understand and address. Now, as far as your risks are concerned or red flags, then yes, when you have high estrogen, you have higher chances, the longer exposure, you have higher chances of breast, ovarian, uterine, and gynecological cancers because your body is exposed to estrogen for a longer period. But at the same time, every cloud has a silver lining. So here that silver lining is that if you have your periods going on, that means your ovaries are producing the hormones, you are having the hormones. So your bones won't lose their strength. The osteoporosis would be delayed. I remember when I was in Cleveland Clinic in 2007, we did a research on that, having late menopause isn't that bad either. So your bones stay healthy till the time your hormones is high. But yes, we have to understand that a regular checkup and the list of tests definitely increase if you are having late menopause.
So Dr. Glossy, which is the ultrasound that you recommend for menopause? What are they called? What is it called? And also for the menopausal age group, what is the ultrasound that one should get done?
So the ultrasound is the pelvic ultrasound, although we always suggest that get a whole abdomen ultrasound along with the pelvic. Because when a woman is aging any which ways, you are at a risk for having diseases, you're at a risk for having cancers of any type. So get a whole abdomen, once a year ultrasound with your pelvic ultrasound, which has to be internal, transvaginal, which Dr. Meenakshi all the time makes it sure that she writes in the bracket TVS, because many times ladies are hesitant. We don't want to get an internal scan done because we got the internal checkup done. Ladies, here I would like to put this thing very clear that internal checkup done by a gynecologist is different and has a different significance compared to the transvaginal ultrasound done by a radiologist, because that also has, so both the things are complementary to each other. They are not a substitute or one over the other. So these are the things that we do: a pelvic scan internal to see the ovaries, to see the uterus lining, which also has its own cutoff that, okay, post-menopausal, if the woman is post-menopausal, the lining has to be thin, it has to be 5 millimeters and less, and etc. That's how we go about it.
So Dr. Meenakshi, like, Dr. Glossy just spoke about estrogen levels being high if you get your periods till after 55. What are the risks and benefits of hormone treatments in menopause? We hear about HRT replacement therapy all the time. What is it? And when would you say it is indicated for a person to take, or should everybody going through menopause should take?
So I think that's a wonderful question, because that's probably what everyone has top of their mind: hormone, steroid, hormone replacement therapy, whether I should be taking it or not. So like anything else, I would always say that even having excessive salt or sugar is not good. So, taking any medicine without any reason is not a great thing. So there was this WHI study which was done in 2000, after which everyone stopped using hormones completely, because it was shown that women who were on hormone replacement therapy had a greater incidence of stroke and of breast cancer. That study was stopped in the middle because they felt that the cancers were very high. Before that, women all over the world were taking high doses of hormones, actually even to remain young. So till the time your hormones are there, like Glossy said, that Dr. Glossy said, that after 55, that advantage on the bones, you also continue looking younger because your skin and hair looks wonderful. So even for that little blush and remaining young for a much longer age, a lot of women were taking hormones, probably not in India, but in the UK and the US. Now, what happened was that after that, like anything which goes into disrepute, which may be good, when you realize that because there were more cases, we stopped giving hormones completely. Now, that also was a very bad thing because everything has its advantage. It's like, let me put it to you like today, how many women have thyroid disease? If suddenly someone says, ki thyroid medication use hi nahi karni, you imagine how many women are going to get affected because of that. Because suddenly there's a study which says that it can cause this, this, this. But suddenly there's so many women whose skin, hair, body functions also remain good because of the thyroid medication. So then more and more studies were done. And then in about 2012, 2014, they realized that we had been giving the hormones to the wrong set of women. Women over 70 were taking the hormones, women who were overweight were taking the hormones, women who had a family history of breast cancer were taking the hormones, and women with heart disease were taking the hormones. They're actually not the first list where it should be used. So then in 2015, we started getting new guidelines from the International Menopause Society, and now our Indian Menopause Society has very, very crystal clear guidelines that hormones are a wonderful thing, but should be used if and when required in the least possible dosage for the least amount of time. When I say the least amount of time, it doesn't mean a month or 2 months. They can very safely be given for 5 years, and then we need to reevaluate whether they can be given or not. If given in the right age group for the right reasons, it does not put you at any risk, any increased risk of stroke or breast cancer. And that's why if it is recommended to you, after, of course, a healthy discussion with your gynecologist, don't be afraid to use it. Very clearly speaking, there are 4 simple indications of using hormonal therapy. So if they're recommended for those, please don't hesitate to use them. Number 1, like I was talking about, premature ovarian failure. So if your menopause sets in before 40, you need to take hormonal replacement therapy. Otherwise, your bones and your heart will get affected at a very young age. At 55, you will be equivalent, your bones will be like a 75 years old. We can't have that. So then hormone replacement therapy needs to be started and continued till the time of natural menopause, or we say 50 years of age, which is when it's reevaluated. So anyone who gets a menopause before 40, please don't hesitate to take the hormonal replacement till 50. It has to be taken continuously and it's completely safe because you don't have the hormones. Every other woman is having those hormones in her body till 50. That's number 1. Secondly, for hot flashes, which may be disturbing, that is that they keep you up at night or interfere with your regular work, then you must take hormone replacement therapy, and it may be taken for a lesser time than 5 years, because it's possible that your hot flashes finish within a year or so. So that's the second indication for using hormonal replacement therapy. The third indication, in fact, we call it menopause hormonal therapy now and not HRT. So it's called MHT, taking the bad connotation of HRT away. So the MHT, the third indication for using it is there if you have a repeated UTI or if there's vaginal dryness. There are a lot of women who stop having sex because their hormones are finishing off. Now, more women are open about talking about it, and you must realize that even having sex keeps the blood flow to the vagina intact. And that is why if there's vaginal dryness or it comes in the way of you enjoying a normal sex life, or even that cracking feeling inside your body, it's not only about sex, it's an unhealthy feeling of dryness which is happening, please consult your doctor. In that case, local hormone replacement therapy will be given, which again has no side effects, and that can be given even at 60, 65 or 70 if it is required. The fourth indication of hormone replacement therapy is actually prevention of osteoporosis. So even if your bones are getting weaker and you're having any other symptoms, definitely it's one of the options you should be looking at.
So that's about the hormone therapy. But like you said, it's not recommended for everybody, but everybody going through menopause does have all the symptoms. Like you said, the hair would be, you would lose hair or your skin. So is there any alternate medication, not really medication, but any alternate therapy, let's say, maybe natural or whatever, that you would recommend a woman going through perimenopause or menopause should do?
So, so with the hair, with menopause, there may be other added reasons why your hair is going bad. So just see to it that you invest a little more time into your hair care and skin care. You will need to do it. Like I said, every woman in 50s will always say her hair was wonderful in the 30s or in the 20s. Every woman is going to say that. So it is definitely going to not be the same, which is again a part of, say, even the aging process, and your estrogen going down is going to go there. So probably just a balanced, healthy diet. You don't want to play with your hormones also. Like Dr. Glossy said, high estrogen is going to put you more prone to breast cancer and uterine cancer and ovarian cancer. So we don't want to take unnecessary just for the skin and hair, to start taking estrogens, even if they're found in a natural fashion. Frankly speaking, if there is something like hot flashes, women, the ideal option today is to take them MHT. But if she doesn't want to take hormones for some reason, there are natural sources available. So there's something known as phytoestrogen. So all of you ladies, when you're traveling abroad and you'll see those big, pretty bottles of phytoestrogens, everyone picks them up or keeps on sending me pictures that should I buy this? So phytoestrogens are actually estrogens which are present in plants. So usually the reason why we don't recommend them outright is because you can't measure the amount of hormone in that. Then at the end of the day, it's working because it's a hormone. You can't measure the amount, so you can't talk about whatever is going to have the benefits, whatever the side effects, we can't titrate it exactly. But yes, soya isoflavones, black cohosh, red clover, rhubarb. So there are a lot of herbs and plants which are seen to have a good effect. Also, there are some women who cannot be given hormonal therapy for whatever contraindication they may have. So for the hot flashes, there are other types of medications available which may not be hormonal. So that's one. Also, in a lifestyle change, like I said, stopping smoking, regular exercise, regular yoga. So yoga has taken over even in our medical world as one of the things which actually balances your hormones in the menopausal period. So even in the international journals, and there is complete evidence that yoga itself, because it's a mind, body, soul sort of thing, so it actually has seen to work in helping you with menopause. As far as the prevention of osteoporosis is concerned, regular exercise with strength training and resistance training, all three become important, because it's not only the bones which need to be protected. There's something known as sarcopenia also, that is the muscle weakness starts off. So definitely resistance training, weight training, and regular exercise as in stamina building. So your walk alone is not enough. Remember that. You need to do weight training and resistance training in menopause to keep yourself preventing osteoporosis.
Thank you, Dr. Meenakshi. And that gets me to you, Dr. Glossy, because like Dr. Meenakshi said that, taking too much hormone can, and even you said, result in different kind of cancers and things. So what are the guidelines for pap tests and mammograms after menopause or during menopause?
So when you are in this age group of perimenopause, you have to get your annual pap smear and your annual mammogram done. Now, if for 3 consecutive years you had normal pap test or for last consecutive 2 years normal pap test and an HPV, then every 3 years you get the HPV LBC test done. That is for the cervical cancer, and that does not exclude getting an ultrasound screening for the uterus and the ovaries, because many times patients feel that we have got the pap smear done, so that means that we cannot have uterine cancer because we got it checked. Now, uterus, to understand, has got two big parts, or I would say 3 parts if you want to divide it. There's the vagina, which is the external part. Then there is the cervix, which is the intermediate part. And then there is the body of the uterus. So when we talk about gynecological cancers or cancers hitting women, then we have to understand right from vagina to the cervix to the uterine cavity, and then the tubes and the ovaries. So we have to completely understand that pap smear will exclude cervical cancer, but also every year you have to get an internal ultrasound done to look for the ovarian malignancy as well as the lining of the uterus. Now, as far as the breast is concerned, mammogram from the age of 40 onwards, along with the screening ultrasound of the breast, is very, very important. There are 3 things to prevent breast cancer for early detection, for early screening. That is, number 1, monthly self-breast examination, which should be done after your periods get over. So I always tell my patients when I'm doing the ultrasound of their breasts that take a small calendar, put it on your bathroom door or next to the mirror where you're going to stand and do the self-breast examination. The day you start your periods, you put a tick mark, okay, I've started my periods, and a day or 2 days later, you're going to do your self-breast examination, followed by every year your checkup with the doctor for the breast. That is called clinical breast examination. And the third thing comes mammogram and the ultrasound of the breast. If you are less than 40 years of age, you are going to get an ultrasound of the breast. Mammogram is only suggested less than 40 years if you have specific family history, and then or you have specific personal history of exposure to certain medicines or certain your specific problem. Then we do mammogram before 40. Otherwise, after 40, every year mammogram has to be done with ultrasound, depending whether it is a 2D mammogram or a 3D mammogram, because the radiation is different. And you should not repeat a mammogram before 1 year. So 1 to 1.5 years, depending on your history, we suggest that.
Great. Thank you, Glossy. So you say that we should have annual ultrasounds even after you're done with your menopause.
Absolutely.
So that's an important thing. And I think we should all remember.
Yeah, here I would also like to add one thing, that when we are looking at postmenopausal women, we have to look at the ovaries. It is not necessary that your ovaries have shrunken, because there are cysts which might develop. If the cyst is less than 1 centimeter or up to 1 centimeter, we can still consider it as a part of normalcy. However, if the cyst is up to 3 centimeters, so 1 to 3, we keep a very close watch. Ovaries are one organs which are very, very dynamic. They can change within a period of 3 to 6 months. So we have to be very careful and monitor these cysts in postmenopausal, which is possible only with the help of an ultrasound.
Thank you, Glossy. Thank you so much. Dr. Meenakshi, what do you think about the weight gain which happens during menopause, and how do we deal with it? What would you say about that?
So the metabolism does tend to slow down in menopause, and that's why there's something known as middling, or the abdominal weight actually does increase by a couple of kilos. So I guess just understanding that your calorie requirement starts going down and keeping a regular, exercise routine. So cutting down your calories, the basic rule which is there otherwise, cutting down your calories, increasing your exercise, and probably focusing more on health rather than weight is the way to go.
And also, are the estrogen creams safe to use, for you get recurrent UTIs? Are they safe to use?
So clinically, we say that the estrogen creams are completely safe and don't even need a regular follow-up, as in because of the estrogen cream. But like Dr. Glossy pointed out, an annual checkup is anyway recommended. So the estrogen cream does not put you at any extra risk. In fact, it acts only locally, but still, I would always recommend that please don't use any hormone or any treatment on your own just because your friend is using it or recommends it to you. Please discuss with your gynae. If you feel you can't discuss with your gynae, that means you need to change your gynecologist, because she should be your best friend by this stage. And you should be able to discuss all your intimate problems with her. And actually, don't hesitate to just, talk to your gynecologist about these problems and discuss for how long you can take it. I don't think, it's only in India where people keep on buying medicines off the counter, not only for gynecology, for everything else. Because my friend said so, usko ye hua tha to ye le liya. Or probably just asking the chemist and he's giving medicine. That's probably a very bad practice. Dr. Glossy, tell me, I think we doctors are most hesitant about doing this. I will never take any eye drops without discussing it with an ophthalmologist.
Absolutely.
Half my patients will tell me, many ye drops we dal di, ye drops we dal. Why do we do this? I mean, we spend $3,000 on getting our hair done. Why would we not want to spend money on a doctor's consult? I really don't understand. I don't think you should be taking any medication without a doctor's consult.
Absolutely.
So ladies,
absolutely.
we have a
Very
lot of audience questions. So one last one from me before we go on. So what is the take-home message for a safe and smooth menopausal transition from the two of you?
So let me go first. I think what you need to understand is that it's a normal phase of life, and please embrace it. Think of it as menopause. That means you don't need to pause now. You need to learn to live for yourself and, be happy, because a lot of things are associated with mental health, but try to feel that now you are going to be the independent person. So take care of your health, definitely, because now you are the prime person and you need to be, probably more caring for yourself, if I may put it like that.
Absolutely. And one thing that I would like to add here is that something which I always tell my patients is an ounce of prevention is worth a pound of care. You have to do that for yourself, ladies, and right today, make a promise that you're going to make at least a health file for yourself, wherein you are putting that every year, whatever the tests are done and whatever are the due dates, put tags there and make sure that even if you have Khansi, Zukam or anything, and as Dr. Meenakshi said, you are taking over-the-counter drugs, maine Dolo 650 le li, maine ye le liya, wo le liya, whatever you are taking, please make a note of it, put that paper inside. At least you can do that for yourself and your family, because that once you have, God forbid you have any emergency, your health file is ready, your tests are in place. Otherwise, you'll keep juggling through your Gmails and all of that where are the tests, I got it done. So it's important.
Thank you, Dr. Glossy. So the first question which we have is from Tanu. And she says, this is for Dr. Meenakshi. It says, my hot flashes aren't as intense as the ones my friends describe. Is this normal?
I think you should just be a little more grateful to God. So there may be no hot flashes at all. It's perfectly fine. And this is where I was saying every human being is different. If you don't have menopausal symptoms, it's perfectly fine. Menopause is a normal transition. If you have symptoms, you need something else. If you don't have symptoms, brilliant.
Then Swati asks, Dr. Meenakshi, can menopause cause change in women's voice?
No, I would think that probably a little heaviness, but if there's something else going wrong, that there's a specific change in the tone or note that everyone can notice. Don't ignore. It could be something else. It could be a thyroid disorder, or maybe your vocal cords need checking. Normally, women's voice, I can't hear a woman's voice and decide whether she's menopausal or not. Let me put it like that.
Pooja Agarwal says, Doctor, I'm not losing weight and I'm very bloated.
So bloating is water retention, which will also happen at any time. It is possible. So cutting down those little things like cutting down your extra salt, which is there, regular exercise, there is no shortcut, unfortunately, even in menopause, even otherwise.
And Dr. Glossy, if you want to take this, Asa says, what is the common age when menopause begins?
So in India, it says 41 to 51 years of age. 46 is an average that we say. But yes, we do see patients who are coming before 40 also, which is there, and after 52, 53 as well. But the mean age is about 46. So that's the age group that we hit on in India.
Geeta says biology, emotional, physical, everything seems off for me.
Yeah, I think so. You know, there are those 7 witches of menopause: itchy, bitchy, cranky, sweaty. So that's okay. I think I have that somewhere on my phone. So the 7 witches of menopause, like the 7 dogs that we had. Let me just read it out to you, Geeta.
Please.
So
While
the
you
7
take that,
witches of-
somebody had asked that question on voice change, right?
Yes, Swati
You know,
did, yes.
there's something that I read. There's a research that says that there's a lot of throat clearing that begins to happen in some patients, some ladies, not in India though, which they have a lot of throat clearing after some time that becomes there because of the dryness that hits. But as such, as Dr. Meenakshi said, I don't think there are any changes. If you are a nightingale, you would remain the same.
Well, Lata
So,
Mangeshkar
yeah, the
proved that.
7 witches which we were talking about, it's itchy,
Yes.
bitchy, sweaty, sleepy, bloated, forgetful, and psycho.
Well, I didn't say it, so yes. Vani asks that what if they are getting heavier and more painful? I guess she's referring to her periods. What if they're getting heavier and more painful?
So that's the important thing. I think that's a very pertinent question. That normally menopause or perimenopause, your periods should be getting delayed and they should be getting scantier. But ladies, remember that usually gynecological problems which need heating also happen between 40 and 55. So if your periods are getting heavier, if they're coming more frequently, or they are painful, it could be a sign of fibroids, could be adenomyosis, could be polyps, could be anything. So please don't ignore it. And when your friends tell you you're in menopause, please don't accept it. Go see your gynecologist, get an ultrasound done. Definitely, if there's a problem, it needs to be heeded. So any menstrual irregularity which happens between 40 and 55, also please don't ignore it and just put it to menopause. Please see your doctor.
And then doctor, what Anita says, I'm not having periods since last 11 months. I'm having hot flashes since last year. Last 3-4 years, it has increased in frequency now. It's bothering me a lot.
Yeah, so that's exactly the point where MHT or other alternative medicine needs to be taken. So if it is bothering you enough to, interfere in your regular lifestyle, it can't be managed with just a little bit of deep breathing and little exercises, little water, little iced water or something. Please see your doctor. There are remedies available. I don't see why you need to accept it as acha ye menopause hai, hota rahega, and suffer in silence. The time for women to suffer in silence is gone because there are safe options available. Please understand that.
Dr. Glossy, this is for you. There's no name of the person asking, but she says Dr. Glossy, what I need to ask Dr. Glossy about fear of getting change in body during menopause.
That I think Dr. Meenakshi had already answered, that there are going to be some ounces, pounces here and there. But if you know that your calorie intake needs to go down and your exercise needs to go up, and that to your strengthening, Pilates, all of that, then you know that, after 40, you are going to change your lifestyle. You are going to not only include cardio, but also strengthening exercises. Then there is absolutely no change.
This is a very interesting question. I don't know who the sender is because there's no name to it. Can a woman get pregnant during premenopause?
Yes, absolutely.
Yes. Absolutely.
So yes, so till the time your periods don't cease for at least 6 months, please don't stop using protection. That's very, very important, because there are women in their late 40s who are pregnant and they don't even realize it because their periods are irregular. So you have to use contraception. Please don't think that the time is gone. If you remember, probably when you were children or something, you used to have bahu ke bhi bacche ho rahe and saas ke bhi bacche ho rahe, and all that used to happen, so many years back. It's true. You please use protection.
Okay. Parna wants to know, are heart diseases or heart attacks more common in menopausal women?
Yes, estrogen is cardioprotective. And that's one reason, that's one benefit also you get of late menopause, that your heart remains protected. And that's why if you realize, as far as blood pressure, as well as say heart disease and heart attacks are there, it's, women now lead probably a busier life than men do. I think everyone on this forum and platform will agree.
Absolutely.
But women don't get heart attacks at 35 or 40.
Yeah.
You hear of so many men getting heart attacks at 35, 40, blood pressure issues, and taking treatment or taking medications, taking cholesterol medicines. Women don't, while in their 50s they do. That is because the estrogen is cardioprotective. And when the estrogen goes down, you are the same or even more prone to heart disease than someone who is having her estrogens in her body.
And even then, you don't recommend estrogen for everybody, not even on a low
so
dose.
so that's the problem. That's the problem. Again, we are still learning. We're very wary. We started using hormones about 8 years back again. We go only by the guidelines. It's a wonderful thing. Women who are taking estrogen for hot flashes get the benefit of cardioprotection. Women who are taking for some other reason get the benefit of cardioprotection. But currently, at least as of today, cardioprotection is not an indication for giving MHT. I probably will change 5-10 years later, but that's the recommendation today.
Are menopausal symptoms genetic?
So there are two things. Number one is that women who get early menopause, they say that the age of menopause is quite similar. But, your cousins and mom and masis and first cousins got an early menopause, there's a chance that you'll get an early menopause. But it's not necessarily so. Similarly, how you react, it could be possible, how your body reacts. But aisa nahi hai that just because your mother had a difficult menopause, you're going to have a difficult.
So Dr. Glossy, this one is for you. If one has a late menopause, 57, should one get mammogram every year and pap smear every year? Though I think we've kind of answered that, but anyway.
Yeah, we already did that. More the reason we have to get it done, because of your longer exposure to estrogen, you are at a higher risk of having all these gynecological cancers, including breast and otherwise. So you have to get it done once a year, mammogram once a year, pap smear. If your 3 consecutive pap smears are normal, then one can think of, if you've got hysterectomy, uterus removal, then the norms are different. But yes, as a routine checkup, you have to get it done.
And what are hot flashes? Somebody wants to know. Shruti wants to know, what are hot flashes?
So hot flashes are a very strong feeling of discomfort. You might be sitting in an AC room and suddenly you'll start feeling very hot and you might feel sweaty. You might want to just take your clothes off, and suddenly after that, there's a sweating and there's a lot of sweating and suddenly you start feeling cold. So we say that if they're happening more than 3 times a week, or they're making you, get up from your sleep, or interfering in your normal work, you must take treatment. Otherwise, just take it with, probably just little breathing exercises, little relaxation. So how this started now being talked about, I don't know if most of you must have seen Bombay Begums. That was a serial which came on Netflix during lockdown. The first scene has Pooja Bhatt. She's a big entrepreneur and she suddenly drops, out of a meeting to go into the bathroom and suddenly goes under that, jahan hand dry karte hain, and she dries her underarm and she's having that feeling of, not being normal in the middle of a meeting. So that's what a hot flash is.
Then somebody's asked us, does taking thyroid medicine, in bracket hormone, interfere with menopause?
Thyroid is a different hormone. There are a lot of hormones in the body. Insulin is one hormone, which if you don't have, it's diabetes. Thyroid is it works at a different level. Your ovaries are different. The estrogen and progesterone are your ovarian hormones.
And how many years, Aparna asks, how many years do we experience hot flashes post-menopause?
So there is no such norm. Like I said, there may be people who may not have hot flashes at all, and they may have a very smooth menopausal transition. There are people who may have it for 6 months. There may be people who may be having it for a year. There may be people who have it for 5 years, but we say that if they are disturbing, take treatment, otherwise let it be. They are transient. They will go away at some point or the other, usually within a year. However, remember that if the urogenital symptoms are occurring, just a pointer here, if the urogenital symptoms, that is recurrent UTI or vaginal symptoms are happening, they are not transient. They will only worsen with time. So if they are there, please don't try to live it out. It's only going to get worse. Please take treatment at the right time.
Then there's Dr. Meenakshi. My periods have started becoming irregular, sometimes within 15-20 days apart, scanty only for 2-3 days. Does thyroid and PCOD have effect?
Absolutely. Yeah. So irregular periods, there are a lot of reasons why your periods will get irregular. Thyroid could be one reason. PCOD may be another reason. Prolactin issues may be another reason. So again, the same thing, just conversing it out is not a great idea. Just come and see us. We'll get the investigations done. Because logically speaking, if there are 6 reasons why something wrong can happen, it's important to see what is the reason for you and treat that only, rather than just kind of hitting shots in the dark.
Other thing coming in is collagen. Should one take collagen, and can one take collagen with metformin medicines for PCOCs?
So collagen is the new kid on the block. A lot of it are taking collagen. I've seen 23-year-olds take collagen. So maybe I've now become old school. I really couldn't see the reason why. So this is like one of those supplements which may not work, may make you feel happier. It has no relation with your other medication. So yes, scientifically at least, if your dermatologist feels you need collagen or you need collagen, again, see a dermatologist and take it, or a physician and take it. I don't think gynecologists are prescribing collagen for you. But yes, if you have a thyroid issue, other medications, please continue them for sure.
Dr. Glossy, this is for you. Do we need, if we are vaccinated for cervical cancer, then do we need to do the scans?
Of course, we need to do the scan. I mean, you have to understand, and especially after COVID vaccines and talking so much about the influenza and all of that, that all these vaccines protect you from the viruses, from the infections, from the repercussions, from the cancer to a certain limit. But if you have precancerous lesions, you have to understand that vaccine will either decrease the intensity of the lesions that you're going to have, but you cannot be sure that I've taken a vaccine, I don't need my test. You have to get the pap smear, HPV, liquid-based cytology, LBC, along with ultrasound as your checkup annual as any other woman who's not been vaccinated.
So Glossy, finish. I would like to make a point here also. Please
yeah,
finish.
Please continue, ma'am.
No, please finish.
So it's important that you have to get your tests done. That was the emphasis on that, even if you are vaccinated.
So what I was trying to say is that I have this model in front of me for clarity for everyone. This is the vagina, this is the cervix, okay? And this is where the cervical cancer happens. This is your uterine cavity. These are your tubes, and this is what the ovaries are. Even the new Gardasil vaccine, which is Gardasil 9, which prevents 99.5% cancer of the cervix, if that is given when you are sexually naive, okay? That means to the younger girls, even then, it is only protecting you against cancer here. It is not protecting you. It has nothing to do with your uterine cancer or your tubes or your ovaries. So please understand, the vaccine is only for cervical cancer, which is number 2 cancer in women. And it's one of the commonest cancers, but that's all. The cervix is what is protected. I hope it's clear to you, the white bit here. Only that is what is protected. And even then, the current recommendations say the pap smear is for cervical cancer, right? To prevent or to pick up early lesions. Even your cervical cancer, pap smear needs to be done regularly, irrespective of whether you're vaccinated or not. Your vaccine needs to be done irrespective whether you get a pap smear or not. And the other test that we are all talking about, that's your uterus, your ovaries, your tubes, or your breast, has nothing to do with the cervical cancer vaccination. The newer vaccine prevents 99.5% of cervical cancers, prevents anogenital cancers because of the HPV, even oropharyngeal cancers because of HPV. But it has nothing to do with your uterus your tubes, your ovaries, or your breasts. Please be clear on that.
Thank you, Dr. Meenakshi, for that. There's another one coming. This is, I get hot flashes at 40 and my basal temperature remains high and my body starts bloating 15 days before menstruating. Are these signs of early menopause?
Possible. It is possible. Hot flashes are one of the earliest signs of menopause, but definitely if your cycles are regular and on the clock, we don't start investigating for menopause.
Okay, so, then there's another one. Can you please also shed light on post-hysterectomy, menopause, and things to take care of?
So post-hysterectomy, if your ovaries have not been removed during the surgery, we nowadays try to avoid removing the ovaries during surgery if they are normal and healthy. You are not menopausal. Your ovaries will continue functioning. They'll continue sending to the hormones to the rest of your body. More importantly, you need to understand that your regular checkup needs to continue because your ovaries are there. Ovarian cancer is a disease of extremes of age. It's seen in the very young girls and it is seen in women in their 70s and 80s also. And that's why, and the unfortunate bit about ovarian cancer is that it's a silent cancer. That means that because there's so much space in the abdomen, the ovaries will continue growing and you will have symptoms only when the cancer invades the urinary bladder or the gut or has a distal metastasis. The only way of picking up ovarian disease is by an ultrasound. So even if you have had a hysterectomy and your tubes have been removed, tubes is where usually ovarian cancer starts, but your ovaries are left behind. You need to be doing your regular ultrasounds, your scans, your mammograms as per schedule. If the pap smear was done for a non-cancerous condition, your regular pap smear after that is not, if the surgery was done because of a non-cancerous condition and your cervix was completely removed, pap smear is not required after that, but your regular annual checkup as well as the investigation like ultrasound and mammogram are definitely warranted.
Thank you, Dr. Meenakshi, and thank you, Dr. Glossy. Now I'll give it to Megha, my vice chair, to do the closing, please.
Thank you so much, Dr. Glossy, Dr. Meenakshi. I was so engrossed in making notes, I completely forgot I had to thank you and close this amazing, absolutely amazing conversation. And so, Dr. Meenakshi, my take home, it's not, it's definitely menopause, but it is also menopause because I am not pausing. Menopause, pause, and just take a back seat for that aloo paratha that you were expecting of me because I have to take care of my health. I need to attend to myself. I want to transition into the next phase of my life, which nature has designed so beautifully. So I needn't take any stress. I just have to go with the flow. Thank you so much for all the knowledge that you passed on to us. It is indeed very, very helpful and I'm sure has eased a lot of us. And to all the audience who have logged in, please do log in the next Thursday as well on the 16th when we decode what is normal, what is subnormal, what is abnormal, know your tests. And we will have eminent speakers from the field. Thank you so much, Dr. Meenakshi, Dr. Glossy, once again, and to the IWN family for always imparting such meaningful knowledge to everyone. Thank you so much once again.
Thank you.
Thank you, Nandini. Thank you, Megha. Thank you, IWN. Amazing platform, amazing interaction. Thank you so much.
And thank you to the Secretariat. Thank you, Priyank, for having our back. Thank you.
And to all the vertical heads, vertical members, and the IWN family, and all the other audience who logged in and gained knowledge today, thank you so much. Immense thanks.
Thank you so much. Wonderful and a very, very informative program. Thank you so much, Dr. Ahuja, and thank you so much, Dr. Glossy.
Thank you so much for having me.
If we didn't have a time restriction, your questions would have gone on to another hour, I think.
Yes. And I've actually been making notes. I don't know if you can see here.
So if any of the questions were not answered by the audience, they can always connect with Dr. Meenakshi and me. We are available on the phone.
Thank you. Thank
Lovely.
you, Glossy.
Thank you very much.
Thank you so much.
That's really kind of the two of you. Thank you so much.
Thank you so much. Bye.
Megha, can we log out?
Yes, absolutely right.
Thank you. Thank you.
Thank you. Thank you so much.
Bye.